While doctors tout the benefits of vaccinations and schools require children to be immunized against potentially harmful disease, the subject of vaccines remains divisive. That's not stopping an Oklahoma lawmaker from revisiting the issue, despite opposition from opponents who believe the state should not be involved in the decision to immunize children.
State Senator Irvin Yin says as a physician, he has an obligation to work toward increasing childhood immunization rates. According to Yin, Oklahoma's vaccination rates have fallen dramatically during the last decade.
Measles, mumps, rubella. In Oklahoma, the vaccination rate for kindergartners used to be 95%. We're now at 90%. We're tied with, I think, 5 or 6 other states at 90%. There's only one state lower than we are. That's Arkansas at 89%. That's not high enough.
That's why he plans to introduce legislation next session that would limit exemptions for immunizations required by Oklahoma schools.
Currently, statute says that if you want to send your child to school, and it says public, private, or parochial school, they shall be vaccinated for 11 different vaccines. Okay, and these are vaccines that have been around a long time. There are not any really new vaccines in here. The flu's not in there, meningitis is not in there, HPV is not in there.
Yin introduced legislation last year that would have removed all vaccine exemptions except those for medical or religious reasons. That measure faced opposition from the group Oklahomans for Vaccine Choice. Liza Greevy is the group's chair.
My first child received over 40 vaccines before the age of 18 months, and he was critically injured. And we went to vaccine court, and they kicked our case out. So I am one of those who followed the rules, got burned, and now I'm here to fight for everyone else's choice.
Greevy argues vaccines pose a risk to children's health and believes Oklahoma's current vaccine exemptions should remain in place. She also questions whether immunization rates are actually falling that fast.
Only 1.5% of Oklahoma students are actually filling out exemptions. And that doesn't mean that those 1.5% are unvaccinated. That just simply means that their parents have chose to opt out of one vaccine, at least one.
Doesn't seem like a lot, but it's definitely increasing. And also I can tell you that in adolescent immunizations, for instance, the meningococcal, the meningitis vaccine, our rates dropped from 72% to 68% according to the CDC last year.
Dr. Thomas Cools heads up a newly formed group, Vaccinate Oklahomans, which promotes mandatory vaccines. Cools believes the numbers are cause for concern.
As immunization rates drop in a population, what ends up happening is we're going to see outbreaks of disease, similar to what we've seen in terms of mumps that's been occurring in Enid.
According to the Oklahoma State Department of Health, 117 people in Garfield County, where Enid is located, have been diagnosed with the mumps as of October 31st, but Greevy argues that's not due to falling immunization rates, since the majority of those who came down with mumps had been vaccinated against the disease.
Show me the numbers of the unvaccinated exempted children who came down with mumps. Show me the vaccinated children and adults who came down with mumps. Show me the adults in our community who are unvaccinated for the last 40 years, and we have not had herd immunity because most adults do not have their boosters. Show me the epidemics that we, quote, should have had.
I hear all the time, well, a lot of the people that got mumps were immunized. Well, that's true because immunizations aren't perfect. They're only 80 to 90% effective. And if they're 80 to 90% effective, even though most people have been immunized, a number of immunized people are still going to be at risk too.
Greevy insists she's not anti-vaccine, but doesn't believe immunizations should be required.
We are for parents deciding. The state, doctors need to stay out of that.
Cool says that takes choices away from other parents.
The parents that I have that go to school and go to public schools, they have a choice too. They have a choice to send their kids to a school where their kids are safe and are protected because everybody else around them is immunized.
Yin says he plans to introduce legislation next session that will remove all but the medical exemption for vaccines, meaning parents would no longer be able to cite religious or personal reasons for refusing to have their children immunized.